Hello, you've been referred to North Devon District Hospital for an outpatient appointment or diagnostic test. We aim to start the treatment of your condition within 18 weeks of receiving the referral from your GP. This may include x-rays or blood tests. Depending upon your diagnosis, you may go on to have an operation. This DVD is for you to watch at home, so you know what to expect at every stage and are familiar with our facilities before you arrive. It outlines the people and departments you're most likely to visit. For more information, you can follow the links on our website. If you can't make your appointment for any reason, please let us know as soon as possible by calling the telephone number on your appointment letter. Giving us enough notice means we can offer your appointment to someone else. There are several ways you can get to hospital. These are all on our website, Coming Into Hospital, or the Patient Advice and Liaison Service, PALS, can help you.
Most people come by car. There is a drop-off point at the main entrance, and the car park entrance is near the main road. Our parking charges are some of the lowest in England, and there may be discounts if you think you'll be coming to hospital often. Please ask at the information desk in the main foyer for details. If you're using public transport, regular buses stop right outside the front door.
To help you find the right room, there's a directory by the front door. Also, the information desk can help with directions, with wheelchairs or any other assistance required. When you're figuring out how to get about this hospital, remember, the front door is on level 2.
Also on level 2 is the pharmacy, where you may need to pick up your prescription if one is given to you at your outpatient appointment. We have 2 cafes on site at North Devon District Hospital. U Cafe on level 2 for light meals and drinks, and the Rally Galley on level 0 for hot food and drinks. The opening times are displayed around the hospital. There's a shop where you can buy basic provisions and magazines. There's also an information centre where you can pick up leaflets, look online at our library of patient information, and also ask questions of the team. The Patient Advice and Liaison Service, PALS, is based here, and they'll be able to assist with any problems or concerns you may have during your visit or stay. Toilets, disabled toilets and baby changing facilities are clearly signposted from the front door. Before you go any further into the hospital, though, there are some important points to bear in mind.
What considerations are there when people come into hospital so as not to spread infection?
Well, one of the main things would be for the visitors to actually come in when they're well. If they were to come in, for example, with diarrhoea and vomiting, and that has a potential to spread, so that wouldn't be good for our patients, and they would not like the idea of actually thinking that they'd cause some further illness in the patients. Perhaps one of the other things is our hand washing. Hand washing and the use of alcohol gel are very important in order to help prevent the transmission of infection between individuals, from visitors, from staff, to patients, and between us all. So to make sure that they have cleaned their hands either with soap and water at one of the hand wash basins or to use gel is really good.
And what about staff? If you see a nurse approaching, you're not sure if she's washed her hands, would they be offended if you asked?
No, I'd really like the visitors and the patients to ask. That helps keep us on our toes.
Lovely. There are several outpatient areas. Your appointment letter will tell you which one to go to. If this isn't clear, please ask at the information desk on the way in. Your letter should also say whether you need to come in any earlier than your consultation time for a diagnostic test beforehand. In the future, we hope to be able to offer an automated call service to remind you of your appointment. What happens when someone first arrives at outpatients?
They'll go to the designated outpatient area. They will be seen by the receptionist who will check their name, address, date of birth to make sure we have the correct patient. The notes are then put onto one side, patient will take a seat. The nurse will then go along and call these patients and do any basic observations that are required for the specifically they're here to be seen in.
Who else are they likely to see on the first visit?
They'll have already seen the receptionist and the nurse, so following that they'll usually go and see the doctors, and there is a possibility they may see a specialist nurse, but that is usually on a follow-up appointment.
Are there instances when clinics overrun?
Yes, they can overrun. But they usually overrun because a patient is requires more time with a specific doctor, and they will give them the time that is needed so that people walk out of here feeling that they've had a really good consultation. We do try to notify patients by sticking the time delays on the notice board in each waiting area that we have.
When the patient first comes up to outpatients, we'll go and get them from the outpatient area, explain who we are, why they've come to see us. We look at the GP's letter, and then we sit down really and ask them questions about what the problem is, trying to really find out more information about their symptoms. Once we've done that, we then examine them, because that often gives us extra information. And then after that, we'll sit and talk together, go through the information that we've found, and then really discuss about what we think is wrong. And sometimes that's obvious on the first appointment. Sometimes it's not, and we need them to have other tests done, and that might be, for me, having a CT scan of their chest or some breathing tests, and for other specialties, different tests. And those get booked, and they'll often come back at a later date for that.
During that consultation, what opportunity is there for patients to ask questions?
Patients can ask questions any time they like. They can obviously interrupt us if they think we're not getting the right picture. But at the end, we summarise what we've talked about and then ask them at that point if they've got any other questions that they want answered. And sometimes it's quite a complex issue, so we do encourage people to bring a list of things that they want to make sure that they've covered in the consultation. If we need to follow patients up, then we try and follow them up close to home. We have community hospitals such as South Molton and Holsworthy, and a lot of the consultants have clinics in those areas, so we try and follow up people close to home.
There are several different types of tests that we might do to try to reach a diagnosis or treatment plan. These are a few of them. Firstly, pathology. Most patients will have a blood test, and the samples will be sent to our nationally accredited lab at North Devon District Hospital.
When specimens arrive in the department, they are checked rigorously to make sure that the details on the specimens match those on the request form. We have to be absolutely sure that the specimen belongs to whom it says it belongs to. And when that's all done, the patient's information is entered into a computer system, and the specimens are tested partly by some of the very sophisticated analysers you can see behind me, and some manual testing's done as well. We test approximately 1,500 to 2,000 specimens a day in pathology here. We're a fully accredited laboratory, and we aim to turn around most work within about the same working day, if not one day after.
What reassurance should people take from your accreditation? What does that mean?
It means that the laboratory performs to a very comprehensive and difficult set of nationally agreed standards. We inspect it every 4 years to prove that we do conform, and we're currently fully accredited. It's just an assurance that we perform to the best possible standards. It's more or less inevitable if you come into hospital, you'll have a specimen of some sort sent to pathology, whether it's blood, warts, moles, lumps, bumps, even whole organs. And it's been shown by audit that pathology can account for 80% of diagnosis, prognosis and monitoring of treatment.
Another option for diagnosis is radiology. This includes X-ray, MRI and CT scans. Each are used for different reasons, but this trust has recently invested in the latest equipment to ensure the test is short and the pictures of the highest quality. There's also endoscopy. This procedure uses the latest technology. By putting a tiny camera inside you, we can investigate your throat, tummy, bladder, lungs or bowel to see what might be causing your symptoms. The procedure is quick and doesn't require surgery. For information on other procedures, please check our website. If you've been told that you need an operation, you will most likely be sent to see the pre-operative coordinator, who will schedule an appointment. Where possible, they'll give you an operation date, and if they can, see you for your pre-operative assessment there and then. This assessment can take place up to a maximum of 8 weeks before your operation.
A pre-op assessment is an assessment to make sure you're fit for the surgery. It's a chance to answer any questions you may have about the operation, and it's a chance for us to explain how long you'll be off work, how long before you can drive again, so some of the expectations of the operation from you.
What tests do you carry out?
If you're over 55, we test your heart. We do some blood tests on you to make sure you're not anemic, make sure you're not diabetic, and make sure your kidneys are working okay. If you're under 55, we just weigh you and measure you, check your blood pressure, and we test everybody coming into hospital for MRSA, and we test all orthopaedic patients for MRSA as well. About 1 in 200 people carry MRSA on them totally harmlessly. It causes you a problem if you have surgery, so it's important that we know about it, so we can help get rid of the chances of it causing a problem by giving you skin preparation. We also give you some nasal cream. And also, if we treat people for MRSA, we reduce the risk of spreading it to other patients.
Is there a chance at the pre-op assessment to ask about the operation itself?
Absolutely, you get a chance. We talk to you about the operations and we go through the risks and benefits of the operation. And if you have any questions, we'll answer any questions that we can there and then. The pre-assessment nurse will, in some ways, case manage you. So that nurse will be responsible for you from the pre-assessment appointment up until the operation. So if you have any questions, she'll give you a contact number and she'll always get back to you. So if your health changes or you go away and think about, what about if I need to do this, she'll answer any questions. We ask you lots of questions about your general health, and you'll probably find people ask you the same questions over and over again. That's not because we've forgotten or we haven't written it down, it's just a safety aspect to make sure we've covered everything basically. So it's all about safety, but you will find there's certain repetition of questions.
And you give people various information to take away with them?
That's right, we give you information about the actual specific operation, but also information about general things like coming into hospital, certain risks like blood clots and anaesthetics and that kind of thing.
On the day of your operation, you'll go to the admissions lounge. You may be visited here by the surgeon and anaesthetist. Any last-minute checks will be carried out by a nurse and you can get changed, ready for surgery. If you're accompanied by a relative or friend, they may not be able to stay with you whilst you wait, but they will be given information on who to contact to check on your progress. When it's time for your operation, you'll be collected and shown to the anaesthetic room in theatre. After some final checks, you'll be asked to sign a consent form.
Right, we're just going to do what's called our sign-in, which is the routine check, so everybody knows who you are and what you're having done, okay? We'll do this for everyone.
So we'll run through some more checks. Could you tell us your name?
Jo Smith.
And your date of birth?
01/02/1974.
And the case number is 123456.
Only then will you be given your anaesthetic and your surgery will be carried out. During your observation, the anaesthetist will be with you, monitoring you at all times. There are a lot of staff and equipment in theatres. It's all to ensure your safety during the operation. Afterwards, you'll be taken to the recovery unit in theatres, where you'll come round under the constant care of specialist nurses.
When a patient is admitted to the hospital, they'd be brought to the ward and then they'd meet a member of staff who they'd be introduced to. Then they'd be shown to their bed space and they'd be told roughly what's going to happen whilst they're in hospital.
And who are they likely to see during their stay?
And they'd meet the nursing, both trained and untrained, the doctors and the junior doctors, the consultants, and the support services, which would be the physiotherapists, occupational therapists, and any other support services they'd need, like perhaps a dietitian or the speech and language, those types of services.
At what point are you able to give them some idea of their likely discharge date?
Well, we'd be planning discharge from admission, so we'd be talking to the patient and the relatives and involving them in their discharge process. It depends on whether they would need some care at home, those types of things, as determining the length before they can go home.
And do they have to think about their own transport home?
Yeah, we would ask independent people to look at providing their own transport, but if they're not able to, if they have a medical need that they couldn't do it, then we would provide it here within the hospital.
How reassuring do patients find it to be kept sort of informed of what's happening?
Yeah, I think it's really important that we inform patients throughout their admission, you know, telling them that we're planning their discharge and keeping them up to date with information that they're being given throughout their hospital stay.
And it's all about being consistent and letting everyone know what's going on.
Yeah, and so obviously the documentation is really important that we put in the patient's notes as well.
Our website on coming into hospital has been created using patient feedback on what information they need before an operation. Click on the links on the left-hand side to find out more. If you or your family have any feedback about your care at North Devon District Hospital, please speak to a member of staff who'll be happy to help resolve any issues. If you need more help, our PALS and complaints staff are here in the information centre on level 2 and they'll be happy to investigate on your behalf. We really care about your experience of our service and need to know where we can make improvements. There are feedback cards around the hospital, including all wards and the blue kiosks by the front door. So please, before you leave, pick one up and spend 5 minutes giving us your thoughts. Your feedback will help us continue to improve our services.